Hello and welcome to all our Gold viewers from around the world. I'm Kristen Schwarz, licensed midwife and one of the MCs here at Gold Learning and Gold Midwifery. And I'm very excited to have a very special guest here with me today. It's Dr. Andrew Dorough. Welcome, Dr. Andrew Dorough. It's good to have you back here at Gold.
Thanks for having me back. I appreciate it.
So, Andrew, you are part of our GOLD Midwifery Online Conference of 2023 this year. You have spoken with us for our GOLD Lactation Conference in 2022 and back by popular demand, I have to say. So now you're here back in the new year for our first big conference of the year, 2023, the GOLD Midwifery Conference. It's good to have you back. And you are a chiropractor, so talk a little bit about your background here for us here at Gold. Number one, where are you located in the world? And tell us a little bit about your background and your work.
Okay, yes, I am from St. Louis, Missouri. I've been a licensed and practicing chiropractor for the past decade, specializing in perinatal care, neonatal care, newborn infant care for the family. So I have most of my postgraduate experience in clinical practices in, I would say, that arena. And what I'm going to be covering for the midwife conference would be getting a more of a perspective from my point of view on what a chiropractor does, and more specifically, what Webster technique does to assist the birthing person's family, the midwives, the doulas, and even the obstetricians that are part of this all-encompassing birthing team.
Fantastic. Yes, your presentation is titled Collaboration of Care Providers Utilizing the Webster Technique. And, you know, many midwives out there in the field, you know, have heard about the Webster Technique. Even some, you know, pregnant families, pregnant persons or in their families maybe have heard about the technique. But nobody, very few people really absolutely know what that looks like and what steps are involved. There is some myths also about it. You know, some people might worry, is this even safe? Or what is this for? Is this just getting the baby head down? Or this is about turning the baby upside down? You know, I mean, there's a lot of information floating around that's not accurate. So we invited you here to the Gold Conference to really show us the, you know, information, what it is, the Webster technique, how we can educate our clients on what it really is, and help us understand the benefits of the technique.
Absolutely. You know, one of my wise mentors always told me, you know, Andrew, to see is to know, to not is to guess. And if you ever taken a course with me, you'll see that I have a lot of videos, pictures. It's just very clear cut. I want to bust through the myths, clear up the controversy, and clean up the misinformation. And that was really the whole point of when I developed this content, is to clear all those three parameters. So I hope I do a good job for you guys conceptualizing this for you.
Absolutely. And we're looking forward to it. And you're training other chiropractors in this as well. Is that correct?
Yes, I am currently a postgraduate instructor for the ICPA, which is an international organization that trains pediatric and maternal chiropractors to deliver safe care for the pregnant population and also the neonatal, newborn, and infant population. So I do teach for them as well.
Wonderful. And you just changed office locations, is that correct? You're now in your own private practice?
Yes. You know, the past almost 6 years, I had the pleasure of working in a medical office that specialized in breastfeeding medicine. And I had a new opportunity. I still work with them and collaborate with them, but I outgrew the space. My practice grew over the past 10 years, and I had to move down the road to have my own space. So now it's just my own, you know, Dorough chiropractic clinic. And I do have a registered nurse, IBCLC, that works with me a few days a week just to make sure that we have the continuity and the collaborative care needed for some of these more complicated cases. Yeah,
the continuity of care is so important. And also the holistic collaboration, right, with other care providers. This is what's all about, you know, also for chiropractors.
I mean, my job is to make your job easier, and your job is to make my job easier. And with, you know, many hands make lighter work. And that's just the truth.
Absolutely. Absolutely. Andrew, before I let you go here, what are some last words for us? Some little nugget of wisdom from you here.
I would say, you know, in my experience, if you took my last course with the ICP or with the Gold, there's this dogma that I have realized, and how your little blessing bakes and how your little blessing births can have a dramatic effect on the birthing person and the newborn's life as they come through the next phase or to the world. And I think as collaborative care providers for the birthing person and the baby, the more we work together in making sure our little babies inside the birthing person, develops in a symmetric form, might have an easier delivery. And the easier the delivery is, the less stress, strain, and trauma it has on that little baby, that little blessing that comes out. So that's really my functional dogma, if you will. So if that resonates with anyone, I really encourage you to study with us.
Wonderful. Well, thank you, Andrew, for coming back here and chatting with me, taking time out of your busy schedule there at your clinic and coming here. And it's been a pleasure having you here. And I'm looking forward to the presentation.
Thanks so much, Kristen, for having me. I really appreciate you all and what you do.
And for our viewers now, if you would like to find out more about this presentation and all the other presentations in the GOLD Midwifery Online Conference, I'll invite you to visit goldmidwifery.com. We have our keynote coming up here on February 6th. That is open access. So go to the website, check everything out, and I hope to see you all at the conference. Bye-bye, everyone.